Back here. I'm going to be doing the presentation from 12 to roughly around 12:35, 12:40. And today, what we're going to talk about is my tips for supplementation for any kind of pathology. So I am a chiropractor, but I went for a master's in sports rehabilitation, and I'm actually a certified chiropractic sports physician. So working with a ton of athletes. And basically today, what we're going to talk about is how you don't actually have to be an athlete to get treated that kind of way. And there's certain things that we could do. Let's just take, for example, lateral epicondylitis, so pain in the elbow. A lot of tennis players have it because it's termed tennis elbow, but everyday people can get it as well. And a lot of people have pain lifting up like a milk jug and everything. So we were talking about different supplements that you could take that will kind of aid in that. So just kind of a background. So in grad school, we took a lot of biochemistry. So biochemistry is a fantastic precursor to nutrition. So we had biochem 1 and 2. And in my last couple of videos, saw a couple comments that I dove a little bit too in depth with certain things. So I'm going to try and keep it very basic this time. And so we're just going to just basically go very basic, and we're not going to get into like the nitty gritty stuff here. So how I basically got into nutrition was at an early age. So in high school, I was a soccer player, played in college as well. And I had a chronic dislocating shoulder. So it started my sophomore year of high school, and it dislocated. It still does today, unfortunately. And so what happened was I had my shoulder dislocated sophomore year of high school, and it kept popping out sophomore year, junior year, senior year. And we went to a couple orthopedic surgeons. We went and got a nerve conduction study and went to a couple different specialists. And I didn't want to get surgery that young. And so my dad started researching and talking to people. And that's actually how we came about hearing about the Weiner Wellness Center. So we actually came up here, and I had no idea when I was a sophomore in high school. And the biggest thing that we got on was so I had a torn labrum and a rotator cuff. So I got introduced to supplements around sophomore, junior year, and I got on the Ligaplex by standard process and also the neuropathy. So that's kind of my background, how I got into it. My mom is a nurse, so we did do nutrition, but we also did a lot of NSAIDs too, which I definitely got away from after going to grad school. And that's basically like the history of when I started, when I got introduced to supplements. It's funny how that works full circle because I never, really knew about this clinic. My dad came and picked up the product, but I didn't really know about it. And it's just funny how life works full circle. And now I'm here, and I do a ton of nutritional consults as well. So um, basically, knowing what I know now, I would have done different things differently when I was 16 or 17 years old. So just to kind of start off, a lot of people don't think chiropractors can order lab work. I do a ton of lab work, to be honest with you. So either I'll order it for patients, or if you have lab work from your PCP or your MD, within like 4 to 6 months, I'll interpret it. And then I like lab work because then you have an objective measure. So it's easy. Pain's an objective measure, but it's nice to actually look at a sheet of paper and see certain levels. For example, we'll take D3. They say you could be anywhere from 30 to 100. It's really, really nice to kind of look and say, here's your D3. We're going to get you on certain supplement protocols, and then we're going to reassess in 6 months and see where that number changes. It's just a nice objective form. Now, there are certain people that do not like getting lab work. So we actually have a couple other tools here that kind of assess vitamins and minerals. One of them being the Zytoscan. I don't know if anybody's done the Zytoscan, but it is basically, and I'm stealing this from Joe Messino, it's a lie detector for your body. So you could say, oh, I eat healthy, I drink a lot of water, I do this, do that. As soon as you do the Zytoscan, that will tell you right then and there, truth or fallacy. So I did the Zytoscan, and it actually came back exactly what I was thinking. It was, stress from work, so my adrenals were kind of through the roof, high cortisol, and then I actually followed up with lab work, and then I supplemented based on the lab work. And the other thing we have too is it's called an oligo scan. And that basically is a tissue analysis of vitamins and minerals in your body. So if you don't like getting lab work, you could come and we have the Zytoscan and the oligo scan. And quick and easy for the Oligo scan, you only have to know your blood type, and from there on out, you're good to go. So that's another thing that I kind of like to do as well if people don't like doing lab work. So we'll get into a couple of conditions that I treat, and the supplement and then implementing supplements into the protocol for certain pathologies. Before we start, I'm not a medical doctor. I'm a chiropractor. So we're making nutritional recommendations. When it comes to medication, definitely can't really talk about medication. That's for you and your PCP to handle out. But what we're doing is we are basically talking about different supplements and nutrition that you could do to kind of aid your healing capacity and whatever pathology you have, kind of diminish that. So that's just first and foremost. So, again, how we were talking about my background, I've treated a ton of athletes. But again, you don't have to have be an athlete to experience these problems. So, one common one is like plantar fasciitis, pain in the bottom of the foot. A lot of my marathon runners and D1 college runners, they have it, but everyday people get it too, depending on what kind of shoe you wear. Yeah, I don't get paid by Hoka, but I'm a huge fan of Hokas. Brooks and Asics are great shoes. If you're doing a lot of walking or exercising, that's a great shoe for you. Um, a lot of people with plantar fasciitis, they come in and they're usually just wearing a Nike shoe. Nothing wrong with Nike, but the Brooks and the Hokas, in my opinion, have like a really, really good. They're just better for your foot, to be honest with you. A wider toe box and everything. So, we'll start just like very, very general and broad with musculoskeletal disorders. So, mainly people coming in to see me all have like a musculoskeletal disorder, whether it's a shoulder pain from like a tendon, muscle, ligament, arthritis, a ton of different things. So, the basic and the safest way you could get on a musculoskeletal protocol is going to be the X Flame. Huge advocate of the X Flame. Helps with a ton of different things. And my favorite ingredients in the X Flame are going to be my favorite three natural anti-inflammatories. So you have your turmeric, your quercetin, and your bromelain. I like bromelain a lot. That actually comes from like the core of a pineapple, and that's actually shown to treat like different GI disorders, as well as it's a pretty darn good anti-inflammatory as well. So those are the three that I really, really like, and it just so happens that it's all in the X Flame. So people respond great with any kind of inflammatory disorder getting on X Flame, even if it's a autoimmune one like rheumatoid arthritis. X Flame is going to help a ton with that. Um, and so we'll start very broad with the tendonitis. So we talked about the Achilles tendonitis, plantar fasciitis, lateral epicondylitis, everything being itis. So the suffix of the word basically just means inflammation. So to correctly treat any of those conditions, we need to decrease your inflammation. That's absolutely vital. So we'll take the Achilles tendonitis, pretty common, kind of like pain right above your heel in the back of your calf there. I could treat your soleus and your gastroc, the two muscles that kind of basically make up your Achilles tendon. But if we don't decrease the inflammation from the Achilles tendon, you're still going to have flare ups. So basically what I will do is the X Flame's absolutely massive, and then the topical CBD, because CBD in its nature is an anti-inflammatory and a neuroprotectant. So not only can you use that for different brain functions, but you could use it for your muscles as well. So massive anti-inflammatory. So usually we'll take the Achilles tendonitis, for example. We'll use the laser therapy just to kind of locally decrease the inflammation, get people on the X Flame, and then the topical CBD cream. And then what we'll do is we'll strip out the soleus and the gastroc muscle, and usually that goes away. I don't know, 4 visits max. People start to feel relief. Sometimes people feel relief in 1 or 2 visits, but the big key is just getting rid of all the inflammation. So if you go to an ortho, or if you go to an MD or a chiropractor and they say you have any kind of tendonitis, the biggest thing is getting on an anti-inflammatory. That's absolutely massive. So we'll go next to any kind of very, very common. So there's a study that came out that said they took an MRI of, it was 100 people 65 years or older, and they actually found that 87 of them actually had a rotator cuff tear. Very, very common for people with shoulder pain to have a rotator cuff tear. With that being said, some of my favorite supplements for that is the Ligaplex from Standard Process. So that has a lot of manganese in it, which will kind of really help that muscle and the tendon kind of heal. The other ones that I like for that too is the Ligaplex, and then the green lip muscle works very well as too. And in conjunction with that, you could also take an anti-inflammatory. When people have like a rotator cuff tendonitis, you definitely want to take the anti-inflammatory, so the X Flame or the Inflame 2. But it's absolutely massive that you get some kind of manganese in your diet, and that will kind of help the rotator cuff heal as well. And that goes kind of for like ligament and tendon injuries as well. So the green lip muscle and the Ligaplex, and that's actually what I got for my shoulder. And I did have 2 shoulder surgeries, but what also helped in conjunction with the supplementation was I actually got a stem cell procedure, and the stem cells really helped my shoulder out as well. Unfortunately, stem cells, they work, not covered by insurance. That's a cash thing. That's a bummer. Well, hopefully that changes. But yeah, so quick story about the stem cells. So when and these are rough numbers. So when you were 1 day old, roughly every 1 in 10,000 cells is a stem cell. When you are 65 years old, roughly 1 in every 750,000 cells is a stem cell. So as you get older, it's harder for you to heal. And how your stem cells get to the area. So let's say you're getting up from sitting on your couch and you bang your knee off your coffee table and you have pain there. What happens is you have what's called your telomere on your DNA. It's basically like an antenna. It stands up and signals to the rest of your body, hey, we need stem cells of this area to heal. Unfortunately, as you age, your telomere, so like your antenna, gets shorter and you have less stem cells per cell in your body. So it's harder and it takes longer for you to heal. So I love regenerative medicine. And I got the procedure in my shoulder and that really, really helped. So that's basically just kind of going off of what you could do for like ligament and tendon injuries. Another very, very common condition that I co-manage with primary care physicians is diabetes. A lot of people coming in with diabetes. So two different ways to treat it. If you are a diabetic, it would be nice, and it's kind of hard to treat. Let's jump to the neuropathy. So if you have diabetic neuropathy, so numbness, tingling, pins and needles in your feet, or you just don't feel sturdy on your feet, it really helps if your A1C is at a workable level, right? So 5.7, we would like it to be around there. We could work it with it if it's in the sixes, but if your H1AC is anywhere like 9 or above, we got to get that to a manageable level before we actually start treating your neuropathy, or it's not going to work as well. So we actually do that. There's a setting on the laser for any kind of neuropathy in your feet, and I've been treating around 10 to 12 patients pretty consistently with any kind of diabetic neuropathy. And they're getting great results from not only the laser therapy, but the biggest thing is the glucolyze. So the glucolyze has chromium in it, and that's like the biggest component in it. It also does have cinnamon, which helps with blood sugar. But the glucolyze, the chromium, that basically it helps with insulin sensitivity within the cell. So, and again, I'm not saying I'm treating diabetes. That's for the PCP and the MDs. But it's pretty wild when someone brings in their lab work and they have an H1AC of like someone, let's say like 8. We'll just take a standard 8, and we get them on the diabetic protocol, which is going to be our pro oranges, the glucolyze, and the magnesium. And then if you're having the neuropathy symptom, get them on the neuropathies because it's high in B12. It's very, very common for them to go and get their lab work, and let's say they had an 8 and then it dropped to somewhere in the sixes or like the low sevens in just a couple of months. So that is pretty wild. But if you do go on the diabetic protocol, so the oranges and the glucolyze, you really want to make sure you talk with your PCP, just so if you're any kind of metformin or anything, that you're getting that balanced. So you're not on too much or too little metformin. And again, I work with a lot of PCPs as well. We co-manage patients. So if you have a PCP you like, and you kind of want to come in and if you have any neuropathy symptom and kind of get looked at, and we laser you and get you on the supplement protocol, we could co-manage. I email a lot of PCPs. There's a couple good ones, and we'll kind of co-manage your symptoms. So the diabetes, you got to have a workable A1C. That's the main thing. And then when we're talking about the neuropathy symptoms, so you have 3 channels on a nerve: a calcium, potassium, and a sodium ion channel. Long story short, when you have any kind of pain, numbness, tingling, any kind of altered sensation, think of a straw with a bunch of holes in it. It's like leaky, so you have a leaky nerve, so everything keeps firing. And that's why diabetics, they usually have like their feet don't feel right. They feel kind of like they just don't feel connected with their body, right? So when we get the laser, it actually hits the calcium ion channel on the nerve. So essentially, think of that straw with a bunch of holes in it. We're trying to close down the straw, the holes in the straw, so you have a better signal, so your brain's not firing that signal. And that kind of goes in conjunction with if you ever hear anybody having low back pain with pain running down their leg, you basically have a leaky calcium ion channel on the nerve. So what we do is I usually put CBD, just because it's an anti-inflammatory and a neuroprotectant, topically over. And then our class 4 laser actually penetrates 2.4 inches into your body. So when we put the CBD on and use the photon energy to drive it in, we're going to close down the calcium ion channel. So again, fixing the leaky nerve. That's a big fish to fry. But that's why I'm so blessed that we actually have that laser in there, just because it's a great modality and it helps with a lot of ridiculous symptoms. So like neck pain running down your arm, numbness and tingling, works great. So that's basically what we do for diabetic patients. The also too is low carb diet. Sugar stems inflammation. It's easier said than done. But if you just start instead of it's easy to say, well, just cut out carbs, right? But it's kind of hard if you have them in your diet every day. So what I like to do is say, hey, 7 days a week. How about 2 days this week we try and cut out carbs, and you're just going to say kind of fats and protein, and then you could kind of slowly work towards just kind of increasing that. So that's a big one. Another one that I saw a lot of patients post concussion. So a lot of athletes getting their bell rung. If you have a concussion, the main supplement protocol for that, like your brain food, we have the Brain Boost, which is fantastic. But it's absolutely vital that you have your omega-3, so your fish oil, CBD, and magnesium. That's kind of like your brain cocktail. I worked with a couple patients. His name's Dr. Mickey Collins. He's a neurologist. He works for the UPMC Rooney Complex. Every single patient I have that has a concussion, I'll send to Dr. Collins. Fantastic guy. And basically, what we do is, I put them on that kind of protocol, and then they'll go see him and do different kind of vestibular exercises just to kind of link up your brain and just to kind of help your brain recover a little bit quicker. It's funny because concussions back in the day, everybody heard that you just want to sit in a quiet, dark room, right? Don't do anything. It's funny because nowadays, like you actually kind of want to get blood to the brain. So I recommend patients if they have just like a grade one concussion, small walks. Instead of a long duration at first, shorter duration. So go out and walk for 10 minutes, see how you feel, kind of cool off, get some water, and then you could go out for subsequent walks, because what the research is showing now is you actually want to help with the blood to your brain, just so you kind of recover a little bit quicker. So we do that with the CBD, magnesium, the fish oil, the omega-3s are absolutely vital, and chiropractic adjustment, because usually if there's a concussion, there is kind of whiplash component, and sometimes you could have like a misaligned or a fixated segment in your neck that could be potentially shunting blood flow to your brain. So just getting your neck adjusted actually helps a lot as well. So saw a lot of concussions, and that's basically the protocol. We'll put them on there. Going back to the exercise. So a lot of patients with anxiety and depression. And what kills me is when I have like an adolescent, so like a teenager coming in, and I'm talking to the mom and dad and say, we'll just say his name's Jimmy. Oh, so Jimmy, he's I saw your medication. He's on an SSRI. What's that about? Oh, he has anxiety. He's depressed. Oh, okay. Well, does he exercise? No, he usually comes home from school today and he'll just play video games. An SSRI, so a selective serotonin reuptake inhibitor. You're basically giving your body synthetic serotonin. So that's your natural feel good chemical. So a lot of people with anxiety and depression, they'll go on that. The problem with that is you're getting it synthetically, so your brain naturally says, "Hey, we're getting enough serotonin. We don't have to make or produce as much." So when people go off of them, they're kind of like really significantly depressed. What my advice is, if you have any kid dealing with anxiety or depression, start them off with exercising. So when you exercise, you have a natural release of your endogenous endorphins, so your feel good chemicals, serotonin being one of them. So if you're anxious or you're depressed or you just feel stressed out, go take a walk. Go try and jog around the track. Go to the gym. When you exercise, you have that natural release of the endogenous endorphins. That just helps your brain. So I would start with that. Big advocate of the calm day. Myself, when I'm kind of stressed out, and my girlfriend, she's a physical therapist. When she's stressed out, the calm day, and she goes up to 4 a day, and that kind of really, really does alleviate her symptoms. You could also supplement that with the full spectrum hemp extract. I personally like the sublingual, so the droppers under your tongue. You just absorb it a little bit better, in my opinion, and that sublingual actually helps with the brain the most, to be honest with you. So that's another good one. And then the Super B Complete and the magnesium. So that's the kind of best protocol for any kind of anxiety or depression. Um, Arthritis, see a ton of arthritis. Not too much you could do for that, but we can manage the symptoms. So Let's take, for example, arthritis in hands, very, very common. So people work with their hands, blue collar workers like masons working bricklaying all the time. Basically, what happens is if you're using your hands a lot, like in your occupation or just at home, what your brain tells your body is, hey, we're using our hands a lot. We need to have, it's called osteoplastic activity. So we need to deposit more bone into our hands so we could kind of keep up with the load with what we're doing. So in that instance, HA plus is going to be massive. So the HA plus contains hyaluronic acid, glucosamine, and MSM. So those are like the top three, in my opinion, for any kind of joint, like any kind of joint pain or any kind of like joint pathology. That's absolutely massive. So the HA plus. And you could also take your omega 3D. So the omegas are going to help with that, just kind of lubricate everything. And then the transdermal CBD. So those are the main things you could do for arthritis. To be honest with you, the laser really helps with that as well. So it kind of delays the progression of your arthritis. And everything we just talked about in that example was osteoarthritis. Another big one I see, especially in like middle-aged women and elderly women, is going to be osteopenia or osteoporosis. Basically, if I have any patient coming in and they have a DEXA scan and they are osteopenia, we could do a lot basically to help just kind of ease off the progression so it doesn't progress to osteoporosis as quickly. One of the big things is the Super Cal Plus. And then one of my favorites that I got my mom and my grandma on is the Super K2 Plus. Why I like the Super K2 Plus is it has D3, 5,000 IUs of D3, and then it also has it's also called K, and we have the most absorbable form, which is the MK7. So my best analogy is it kind of works like a quarterback. So the K will basically tell the D3 where to go in your body, where you're the most deficient. A lot of women, it's called like the neck of your femur. So it's kind of like in your hip bone. So here's your hip bone, and it's kind of the neck before it goes down to your femur. Women get very, very deficient there quick, and that's usually the main spot. So if you're on the Super K2 Plus and taking the K2, especially since we have the MK7 form, that's basically going to tell it where to go, and it will basically go and attack that spot first, so you just could have a better bone mineral density. Another thing with osteoporosis or osteopenia is weight-bearing exercises. So there's actually a place called OsteoStrong. It's out in Green Tree, just kind of right up the road. And the biggest thing is so the poster child for osteoporosis is a thin, frail woman. So my mom is 5 foot flat, waking up, maybe 110 pounds, soaking wet with a hoodie on. And so she is the epitome of osteoporosis. So what I have her do is when she exercises or goes on walks, I'll actually have her have like 2-pound wrist weights and ankle weights. And then I'm trying to convince her, she doesn't want to do it, but get a 14-pound weighted vest. So your bones respond to stress. So the more you stress your bones, your brain says, wait a second, we can't work with this load, so we have to increase our bone mineral density at this spot. So what OsteoStrong does, they do great with, and I send a lot of patients over there, is it's basically like time under tension, like loading your bones as efficiently as you can. So if you don't want to go to OsteoStrong, and if you go to like Planet Fitness or LA Fitness, a good easy one you could do to start with is the leg press machine. So the machine where you sit back and kind of push, and you're going to use your legs to press. Put that at the heaviest setting, the setting that you cannot push. And when you maximally exert for around 10 to 15 seconds, that's what I would do, 10 to 15 seconds, push as hard as you can into that leg press machine without moving it, and then relax. And that is basically training your brain to say, hey, we cannot move this weight. We need more bone mineral density down here. And then your body will basically take that D3 and put it into the necessary bones. So I would start with at home, getting a weighted vest anywhere. I would start with like 14 pounds. You could go up to 20, 25 pounds. And just when you go for a walk, that is going to help increase your bone density. Absolutely massive. And I actually just had a patient in 3 days ago. She was osteopenia, and they said that she was going to be have osteoporosis like 2 years ago. We got her on everything, and she's been taking it. And then she started up with the OsteoStrong in Green Tree a couple weeks ago. Loves it, and she just got her DEXA scan, and her numbers actually reversed. They went down, not substantially, but they did go down. Usually, when you get a DEXA scan every 2 years, they definitely rise, and hers actually went down. So that's a huge win for her, and we're just combating her symptoms. Another couple that I see is bursitis, going back to the the itis, meaning inflammation, we could treat bursitis. What I like to use for bursitis is the Relax and the X Flame, and then the topical CBD, in as well as the laser. So the laser is massive for like any kind of local inflammation and kind of resetting the nerve, if you will. So we use a lot of that with any kind of bursitis. Ice works well as home. That's just an easy remedy. So you have the main one is called like the Baker's cyst in the back of your knee. So people coming in, doc, my knee's like swollen as heck. What the heck's going on? I moved the wrong way and I woke up and it's ballooned up. We'll go through a couple different orthopedic exams to make sure it's not like a soft tissue structure, like an ACL, MCL, LCL, PCL, all that kind of stuff. And usually if it's just a bursitis, if we do the topical CBD coupled with the laser and then getting on like an X Flame or an Inflam, respond great. Basically, it's just a burst of sac, so it's a fluid-filled sac that just got a little bit inflamed, and then when you do the necessary things, that resolves pretty darn quick. Um, Now, next, what I see is a lot of circulation going on. So people coming in, doc, I got cold hands and cold feet. What the heck can I do for that? Well, it's just all circulatory system. So I really like the CircuCore just because it's like a nitric oxide booster and a vasodilator. So it's just going to help your arteries instead of being this small to kind of open up, so you could get better blood perfusion throughout your whole body. So that helps with cold feet and cold hands for sure. The other one I like is the Natican Plus because it actually has rutin in it, which helps maintain healthy glutathione levels. Glutathione is basically, it's a massive antioxidant for your body. That's can't be that's absolutely massive for you. And then also has nattokinase in it, which helps to break down. It's called fibrin, which has basically been shown to reduce vessel wall thickening from following any kind of endothelial energy. So that's massive as well for any kind of circulatory disorder. We also have, they're called Normatec compression boots in the back. And what Normatec compression boots do is it works by pneumatic compression. So take a tube of toothpaste, for example. So there's some people that will just kind of say, oh, I'm out of toothpaste, and throw it away. And then there's those certain type of people like myself that will kind of inch everything out and get the most of your toothpaste. So the Normatec boots kind of work like that. So it's pneumatic compression. So what they do is they start at the periphery, so at your feet, and they go all the way up to your groin. So it basically squeezes all the lactic acid and metabolic waste out of your legs, gets highly oxygenated, nutrient dense in your vital organs, and then when you thaw out, so to speak, that good blood goes back to the area, and it just helps everything heal quicker. So not only do like the athletes that are like training for any kind of event, or the D1 athletes that are in season, that they like they like the Normatec compression boots. It will also help with lymphedema. It'll help with circulation. So those are massive. I like them. They were actually studied, I believe, by the FDA for stage 1 varicose veins as well. And how that works is every time you move, your cells create metabolic waste. So what we're trying to do is, if you have any kind of lymphedema, or your veins, they're one-way valves. If those kind of, as you age, they get a little bit weaker, and sometimes you kind of pull blood in your ankles and your feet. When we get those Normatec compression boots on, it just facilitates getting everything back out into your vital organs. Again, so everything gets oxygenated and nutrient dense. So when you thaw out, all that good, all the good healing factors go to your legs. So I like those. Phil, we put you on those. You like the Normatec boots? Yeah. If I ever have a heavy leg day, my legs are feeling sore, if I'm messing around at my house, I got a lot of land, do a lot of stuff outside, I'll sit in the boots on lunch. Those are really, really nice. Um, Heart problems. So if we go to heart problems, a lot of people hear CoQ10, right? So what's CoQ10 do? It actually acts as an antioxidant, which protects your cells from damage. Also plays an important role in metabolism. So my family history on my dad's side, bad blood, bad heart. So I take CoQ10 every single day. There's actually a couple preliminary studies shown with CoQ10, it may slow but not stop Alzheimer's disease, and that kind of works in conjunction with any kind of dementia and Parkinson's as well. So like if I have any patient on Parkinson's, definitely go to your PCP and get all the medication needed. But then what will actually help to do supplement wise, CoQ10. And then there's another thing that I like out there. It's called Dopa Boost, and I believe it's Pure Encapsulations or Douglas Laboratories. The Dopa Boost basically has this called L-Dopa, which is a precursor to dopamine in your brain. So Parkinson's basically in a nutshell is a decrease of dopamine in your brain. So we give you the natural, like the precursor form, so your body can kind of produce that and just increase your dopamine. So CoQ10 is massive for that, and the Dopa Boost. Also with heart problems, I do like the Circuit-Core. Again, it's a nitric oxide booster. So it's basically going to kind of open up your blood vessels just so you could get blood just flowing a little bit better. And couple people say it actually lowers their blood pressure. I could see why, what it does at the physiological level. That's one of those I'll kind of mess around with taking as well. Another big thing coming in, and there's two different types. So people coming in with muscle spasms and cramps. Usually, if it's in like an athlete, it could be due to lack of hydration, so not enough water, or it could be a lack of magnesium. So if I have let's take a D1 athlete for example. If I order them lab work just to just so they're fine tuned. Most of the time, they're a little bit deficient in magnesium. So I'll get them on our Mag 300 because it has like 4 of the bioavailable forms of the magnesium. And then what we'll do is we'll also get them on Relax and Mineral Rich. So if it is a muscle cramp from like an athlete, quick fix for that is if you're actually cramping, if you're cramping during your game or your event, pickle juice. And then another one not a lot of people hear about is mustard under the tongue. Actually kind of helps too if you're having an active cramp. And then I always tell my patients if they're prone to cramping, take around 500 milligrams of your magnesium a day. Get your water in, and then more importantly, you need your electrolytes. So like Pedialyte's huge as well. So even if you drink like half of a Pedialyte before your Friday night light football game, that will help kind of like stove off you cramping. Now, in the older population, if you have a muscle cramp, so like doc, I lay down to go to bed, or if I'm sitting in the couch too long, I feel a Charlie horse in my leg, or like when I lay down, or first thing when I get up in the morning, like I have a Charlie horse in my calf. That could be a deficiency in minerals. So I love Mineral Rich. That's one of the ones. Me and Phil, we had a short stint for shot a day Mineral Rich. We did that for a couple months. We need to get back on that. Yeah. So it could be a mineral deficiency. So I'll get people on Mineral Rich, the Relax, and with the magnesium as well. So basically for muscles to contract, it's the calcium ion channel, and for muscles to relax, it's the magnesium. So if you're deficient in magnesium, you gotta get magnesium in your body to kind of stove off any muscle cramps. And then what I like to end with is what I take every day. So I kind of use myself as a guinea pig, to be completely honest with you, but things I do not miss on. Every single morning, basically my breakfast is the power cleanse. I know it's going to sound gross to a lot of people, but it's the pineapple coconut flavor mixed with the lean greens. I think that tastes great, to be completely honest with you. Yeah. Actually, Jamie, he was the first one that told me, "Dog, why don't you try this?" I was like, "No, that ain't gonna taste good." But it actually is not bad. So I like the power cleanse in the greens just because those coupled cover all your macro and your micronutrients for your whole entire day. So when you look at your the pyramid, right, the food spectrum, that covers everything. So I usually start my morning with that because on a Friday, Saturday night, I will cheat sometimes. I am human. But if I start my day with the power cleanse and the greens, that's basically covering all your macro and micronutrients for the whole entire day. So if I go out and eat junk food, or if I go get a pizza on a Friday night, I know that I already hit everything I needed to hit. Should I be eating the pizza? No, but again, I'm human and you got to live. So I take that every single morning. I do not miss. The other one that I really, really like, it's a newer formula that we have, and we actually have a couple research articles on it. If not, I'll have to print more out, but it's an SPM. So our SPM, it's called a selective pro-resolving mediator. Basically what it is, it's derived from the omega family, but it's not actually an omega. So it's basically a derivative of it. So, and that is actually used for chronic inflammation at the cellular level. So any patient that I have with a certain pathology and they come in, I treat them 2 or 3 times. They're like, "Doc, I feel 80% better." 4 or 5 times, "Doc, I'm feeling 95% better. I just can't get over that hump." What I'll usually do is if we already have them on a supplement protocol that I think is right for them, that's usually the end all that I'll add is the SPM, just because it is for chronic inflammation at the cellular level. Works fantastic. So again, I have a bad shoulder and I had the 2 shoulder surgeries, the stem cells. My shoulder still gives me problems. I will take HA plus for it. I'll take the Ligaplex for it, and then I started taking SPMs for it as well. That is just one that like if you're ever kind of stumped, or if you have anything you're working with at home, and you went to your PCP, you came here, you got treated, you're on all the supplements you think you should be on, and you're still having kind of you're not 100%. SPM's great. I swear by that supplement. That's a fantastic supplement. I also take magnesium every single day, vitamin C and vitamin D. And then I will kind of mix up, like for example, like sometimes I'll do like a heavier liver detox, or sometimes I'll do something for circulatory. So I'll get on the CircuCore, and I'll get on any kind of like nitric oxide booster. But in a nutshell, I will take those every single day. I just think they're great for my body, and the lab work reflects that. So in a nutshell, that's basically what I would do. Supplementation recommendations. If you had recent lab work within 4 or 6 months and you want it to be interpreted, and like say you went to your MD and they said, oh, everything checks out, but you still kind of feel like a little bit foggy, or if you had like an illness and you still don't feel 100%, come in. I'll look at your lab work. Usually it's like a consultation. We'll get you on the right product, and then if it seems necessary that you actually receive treatment with it, we'll get you on the book for treatment. But there's a lot of patients where I'll just basically talk supplements with and kind of review lab work. Love working with it, looking at it, just because again, it's a very good objective measure of what is going on in your body, and just how we could get you feeling 100%. So if you want to get lab work done, if you don't feel 100%, come in, get the Zyto or Ligo, or pop on my schedule. We'll see if we need to order you lab work. I do extensive lab work, and we'll see if we need to get you on anything. And then moving forward, we'll kind of monitor anywhere from like 4 to 6 months out, and just kind of keep you optimal. So my goal is I'm very goal oriented, and my favorite thing, I like trying to meet goals, and I just truly want to improve people's quality of life. So whether it's Doc, my back's killing me. I cannot get off the floor without any pain from playing with my grandkid. Or, Doc, I played baseball my whole life. I'm in a softball league, like an older softball league. My shoulder's killing me. Come in. We'll get everything assessed. I could also order X-rays, MRIs. So, if we go through orthopedic exams and it seems like it's something a little bit more involved, we could always send you for an image to see what's truly going on. Or if it's like, Doc, my diabetes, my feet are killing me. Can you help with my feet? Yeah, we'll try with your feet. But if it seems necessary to get you lab work, we'll order your lab work as well. So if you have any questions, my lunch is from 1 to 2 every single day. Call in, get on the book, and we'll go over some lab work and get you feeling as optimal as you can. Sound good? All right, guys. We'll enjoy the rest of your Friday. Have a great weekend. Nice talking with you. See you guys. When's the next event? 24th of September. 24th of September. We'll talk then.